list of treatment for post-Finasteride syndrome. This is what I have found on Reddit from Dr. Will Powers. Again, I think very clever guy, okay, but I will give you my comments. Honestly, I'm not almighty. It's just my opinion, nothing less. It's not a medical tip or something, okay, so don't take it as a granted, yeah? So let's start with everything, okay? So the first one, GABA boosting, anxiolytics, dopamine modulation, and so on, yeah? So the problem with GABA boosting, you already know that allopregnanolone itself is strong GABA-A modulator, okay? So that's probably the most important thing, okay? So just taking, you know, things like benzos and so on, it will not somehow improve the things. And if you take it regularly longer than 1 week, then you will run into a lot of issues, okay? So buspirone, bupropion, yeah, can help. The problem is that it's not a fix, yeah? So it's not a fix. There are much, you know, important things to do. Don't get me wrong, but many PFS guys are not in great metabolic shape, okay? So fixing nutritional deficiency, supplementing with things like B vitamins and so on improves these things a lot, okay? So also, like, you wanna boost dopamine, you need BH4, okay? Because BH4 is also crucial for dopamine production and also for erections, okay? So nitric oxide, yeah? So GABA, excess GABA, for example, even like taking GABA supplements itself, okay, can further suppress dopamine circuits if overused, okay? So I personally think that you need to have certain level of GABA, even if you increase dopamine, because otherwise also too much dopamine can cause a lot of excitation, okay? So also another thing is, from my experience and practice, is that D2 receptors are more crucial than super high level of dopamine itself, okay? So, but like I said, GABA, it can be boosted through, you know, many other mechanisms, okay? Not just like taking benzos and so on. Like I said, taking benzos long term, try to get off benzos and then you will see, okay? So it's definitely dangerous things, okay? None of this is medical information, okay? So neurosteroid precursor therapy, does it work? Yes, it can help, okay? So definitely it can help. The problem with pregnenolone, DHEA, most doctors, they give you a lot of this, okay? So you need to understand 5-alpha reductase enzyme is not working, okay? In most cases, okay? Test it, okay? So before you start with pregnenolone DHEA, do the test, okay? So don't run this without the test, okay? That's the problem, okay? So DHEA, okay? So I prefer natural ways, okay, how to increase DHEA, yeah? So, but DHEA can be converted into estradiol, but also into DHT. It's a backdoor method, okay? And do I see in guys converting DHEA to DHT? Yes, I see it, okay? But you also need to have support supplements, because most likely your DHEA will convert to estradiol if your 5-alpha reductase enzyme is affected or limited in action, okay? So the same with pregnenolone, okay? The pregnenolone, the only benefit can be that, like, low dose pregnenolone can increase your pregnenolone pool, okay? But you can get pregnenolone from cholesterol, and what's blocking this is mitochondrial dysfunction, okay? So fixing mitochondrial dysfunction increase also the pregnenolone pool, but also you need to have a good nutrition, okay? So enough cholesterol and so on, yeah? Does this work? Okay? So yeah, this is one thing, yeah? Like I said, if this is impacted, like 5-alpha reductase enzyme, there will be a problem. Yeah. So PT141, does it work? Yep, in some cases it works. Okay, it depends on peptide sourcing, quality, how you run it. Okay, most guys overdo. Yeah, so this is really bad. Okay, but it can, like I said, it can increase erections. I had guy who didn't use my exact instruction and like dosed almost 3 times higher, and he has really hard erection for a prolonged period of time. Okay, so the problem is nausea, okay, flushing, blood pressure issues, okay, tachycardia, headache. Okay, so honestly, it can help like restore your brain penis connection, okay, but you really need to do this uh, cautiously. Okay, so otherwise it will backfire. Okay, so you cannot also use it every single day. Okay, so forget this. Okay, so this is the problem. I see many coaches, okay, and this bothers me a lot, or doctors or peptides expert, they tell you, okay, to use it every day. Okay, you cannot use it every day. Yeah, it can work for some guys. At least you can try it if there is some reaction. Okay, so some guys also need to have something like titration dose. Okay, so they slowly increase. Okay, but like I said, not every single day, definitely. Yeah. HCG. Okay, so most likely it only mimics LH in some guys that have like really low estradiol. Maybe boost in estradiol will help. In most guys there is such a spike in estradiol, then from my point of view it makes no sense. Okay, so there are, I think, also other ways that can really boost your testicular response. Steroidogenesis itself is also focused on mitochondrial functioning. Okay, so your mitochondria are not working really well. Okay, so then how you should have more testosterone, DHT, and so on. That's the biggest bottleneck. Okay, from my point of view. Okay, it takes time, guys. Okay, so everyone want to have shortcuts, but this takes serious time. Yeah, and super high doses, they can really disrupt HPTA regulation. Okay, so I'm talking about 2000, 3000 IUs. Okay, so mifepristone. Okay, so I don't think it's a good idea. Okay, testosterone therapy, topical or injectable TRT. Topical, I have seen at least better results for increasing DHT, because you need to understand, you will inject testosterone, but if your 5-alpha reductase enzymes are limited, okay, what you will get at the end? Lot of estradiol. Okay, lot of estradiol means also boost in serotonin. Okay, it's generally a stress hormone. Okay, it also blocks your erections. Okay, so if you do it correctly, yes, it can help in some guys. Okay, so also with topical, I have seen guys where there was a switch like after 7 or 12 months, okay, of using this. Okay, so you don't really need to use a super high dose, okay, in order to get some results. My last client, he was even using like small dose, and he was getting like crazy 200 DHT. Okay, so probably you don't need DHT like that. Oxandrolone, yes, it can have some effect, but you really need to be careful. Liver toxicity, endocrine suppression, even if you are not using this right, potential androgen receptor desensitization, probably I will not run it. Okay, so SERMs, what should I say? For example, some of them, enclomifen, clomifen, okay, they can also decrease IGF-1. Okay, IGF-1, guys, we need this with DHT in order to upregulate 5-alpha reductase enzyme. So honestly, I'm not a big fan of this. Okay, so can it increase testosterone? Of course it can. Okay, in some guys, even short cycle can like reboot the testes, but like I said, there are even better ways. Okay, so how you increase testicular sensitivity and so on. Yeah, cyproheptadine. Okay, so mostly I see some effect in PSSD. Okay, I really don't have serious progress in PFS, guys, because it's anti-serotonin. Okay, so most likely it's helpful for guys that stop PFS and doctor gave them SSRIs. Okay, so this can be helpful. Okay, so there are also other things you need to bear in mind. It has strong anti-cholinergic effects. Okay, and I see it in many guys. Okay, so additional supplements are needed. Okay, so and also I will not use it as a everyday strategy. Okay, so it can be, like I said, helpful in SSRI induced dysfunction. Okay, so but you need to know also how you can take it. Okay, Memantine. Okay, so not a big fan of this because of the one thing. Okay, it's a very strong NMDA blocker. Okay, so strong means bounce back effect. Okay, so there are much better ways, okay, how you can do this, like agmatin. Okay, so guys, I'm talking from experience. Okay, so I see many guys. Okay, so guys, thanks all of these guys, they talk to me because this is also how I get more information. Okay, so yeah, guys, you are helping also other guys, okay, with your things. Okay, so Memantine, no, rather agmatin. Okay, but be careful because also agmatin can affect reward system dopamine if not done correctly. Okay, sirolimus, rapamycin, okay, metformin, okay, not a big guy of both. Metformin can cause, B12 depletion. Okay, so mitochondrial complex 1 inhibition. This is something that I really don't like. Sirolimus, insulin resistance. It can block your testosterone. Okay, it blocks mTOR. Okay, so if I would use it, I would use it probably like once in 14 days or something. Okay, but generally I'm not a big fan of rapamycin. Yeah, valproic acid is a big mitochondrial toxin. Okay, so it can help for guys with anxiety and low GABA. Okay, definitely this would help. Yeah, but try to get off valproic acid. Okay, try to get off. It's very, very hard. Okay, so therefore don't even start. It's not worth. Okay, it's not worth. I understand that natural things, especially for GABA A, work in a slow way, really slow. GABA A can be down-regulated extremely fast, but upregulation or improving the dysfunction can take some serious time. Okay, so dopamine agonists, do they work? Yes, they work. Okay, but also bounce back effect. BH4, okay, D2 receptors make more sensitive D2 receptors and so on. This is way to go. Okay. Oh, calcium channel blockers, I don't know why they should be used. Okay, so you have also natural calcium channel blockers. Okay, so you don't need to take nifedipine. You can take things like taurine. Okay, so yeah, what else? What else? Probably, guys, that's it. Yeah, so also from my experience, fixing NADPH is extremely crucial. Mitochondrial health is extremely crucial. Okay, and also take a look at things like things like methylation. In many guys, I see there is a problem, okay, so fixing this can help a lot. Okay, if you have some estradiol issue, take a look at glucuronidation, okay. Also methylation will fix the issue. What else? Nutritional deficiency, gut health, okay, gut health can also, bad gut health, inflammation will spike IL-6, it will blocks 5-alpha reductase enzyme. And also there are many natural ways how you can also support your recovery. Guys, even your general health is crucial, because many guys with PFS, they had really bad metabolic health when they started using things like finasteride or dutasteride, okay? Let me know what you think in the comments.